You've probably heard the phrase time is muscle. In the medical world, this isn't just a catchy slogan. When a coronary artery is blocked, your heart muscle begins to die within just 30 minutes. The first 60 minutes after your symptoms start is what doctors call the golden hour. This is your window of opportunity. If you get medical help within this hour, your chances of survival and a full recovery skyrocket. Wait longer than that, and the damage can become permanent, leading to chronic heart failure or sudden cardiac arrest. The problem? Most people waste that golden hour on Google. They search for chest pain versus heartburn, or can stress cause left arm pain? If you're watching this right now because you're feeling off, listen closely. It is always better to be sent home from the ER with a diagnosis of indigestion than to stay home and suffer a life-threatening event. Let's get into the symptoms. While everyone is different, these 7 signs are your red alerts. 1. The classic chest pressure. It's rarely a sharp pain. Most people describe it as a heaviness, a tightness, or the feeling of an elephant sitting on your chest. It usually lasts more than 15 minutes and might go away and come back. 2. Radiating pain. Your heart doesn't always stay in the chest. You might feel discomfort spreading to your shoulders, arms, especially the left, neck, jaw, or even your teeth. 3. Shortness of breath. If you feel like you just ran a marathon while sitting on the couch, that's a major warning sign. This often happens even before chest pain starts. 4. The cold sweat, suddenly breaking into a cold. Clammy sweat, especially when combined with any other symptom, is a classic sign that your body is in distress. 5. Nausea and lightheadedness. You might feel sick to your stomach or suddenly dizzy as if you're about to pass out. 6. Unexplained fatigue. This is especially common in women. You might feel so tired that you can't walk to the next room, even if you haven't been active. 7. A sense of impending doom. This sounds psychological, but it's a recognized clinical symptom. Many patients report a sudden, intense feeling of anxiety or a sense that something's very wrong. We need to talk about the silent heart attack. If you're a woman, an older adult, or you have diabetes, your symptoms might not follow the classic rules. For women, you are more likely to experience nausea, back pain, or jaw pain without any chest pressure at all. Many women dismiss these as the flu or stress. Don't. For diabetics, this is critical. Diabetes can cause nerve damage called neuropathy. This can actually mute your pain signals. You could be having a major heart attack and feel almost nothing, maybe just some mild heartburn or unexplained sweating. For the elderly, instead of chest pain, you might experience sudden confusion, labored breathing, or fainting. If you fall into these groups, you have to be even more hyper-aware of your body. If something feels new or unusual, don't wait for it to get severe. I know what you're thinking. Could this just be anxiety? Or did I just eat something spicy? Here's how to tell the difference. Heart attack versus panic attack. A panic attack usually peaks within 10 minutes and starts to fade. A heart attack is relentless. The pain might wax and wane, but it won't go away with rest. Also, panic attacks rarely cause pain that radiates to your jaw or arms. Heart attack versus heartburn. Heartburn is typically a burning sensation in the esophagus that gets worse after eating or when lying down. However, if that heartburn starts when you are walking or exercising, treat it as a heart attack until proven otherwise. If you or someone you're with is experiencing these symptoms, here is your life-saving checklist. Step 1. Call 911 or your local emergency number immediately. Do not drive yourself to the hospital, and don't let a friend drive you. Why? Because an ambulance is a mobile emergency room. EMTs can perform an EKG, transmit the data to the hospital, and start life-saving treatment before you even get there. If your heart stops in a car, you're in trouble. If it stops in an ambulance, they have a defibrillator ready. Step 2. The aspirin rule. If the 911 dispatcher recommends it and you aren't allergic, chew and swallow 1 adult strength, 325 milligrams aspirin. Chewing it is vital. It gets the medicine into your bloodstream faster to help thin the blood and stop the clot from growing. Step 3, unlock the door and rest. Make it easy for EMTs to get in. Sit or lie down in a comfortable position to keep your heart rate steady. Step 4, do not use cough CPR. You might have seen this online, it's a myth and it doesn't work. Stick to the professional medical advice, call 911 and wait for the experts. When it comes to your heart, better safe than sorry isn't just a phrase, it's a survival strategy. Doctors would much rather tell you it as a pulled muscle than see you in the ICU because you waited too long. If this information was helpful, please hit the like button and share this with someone you love. You never know whose life you might save just by sharing these symptoms. For more heart health guides, check out our next video here on. Stay safe, listen to your body, and we'll see you in the next one.